Have you ever experienced unexplained weight loss, persistent fatigue, or unusual changes in your body? These could be subtle signs of cancer that are often ignored. In this video, we'll explore 9 common signs of cancer that might be overlooked and why it's crucial to pay attention to your body's signals. By understanding these early warning signs, you can take proactive steps toward your health and potentially catch cancer in its early stages, when treatment is often more effective. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. Signs 1. Unexplained weight loss. One of the earliest and most concerning signs of a potential underlying health issue, particularly cancer, is unexplained weight loss. This refers to losing a significant amount of weight, often more than 10 pounds or about 5% of your body weight, without any deliberate changes to your diet or exercise routine. It's not uncommon to see some weight fluctuation throughout the year, but if the weight is dropping rapidly and without a clear cause, it should not be ignored. Unexplained weight loss can be a red flag for a variety of serious conditions, particularly certain types of cancer. For instance, it can be a symptom of pancreatic cancer, which often progresses silently and can interfere with the body's ability to absorb nutrients. In stomach cancer, the disease can cause reduced appetite, indigestion, and malabsorption of food, leading to unintended weight loss. Lung cancer can also result in weight loss due to changes in metabolism or energy consumption by the body as it tries to fight the disease. Similarly, colon cancer may cause weight loss through digestive issues, reduced food intake, or a change in how your body absorbs and uses nutrients. The mechanism behind this weight loss can be complex. In some cases, cancer cells may use up a large portion of the body's energy supply, leading to significant caloric burn even when the person isn't physically active. Additionally, the body's immune system may go into overdrive to try and fight off the cancer cells, which can lead to inflammation and further strain on energy reserves. Moreover, many cancers can alter the way the body processes nutrients, leading to muscle loss and decreased appetite. In summary, unexplained weight loss is one of those symptoms that warrants immediate medical attention. Even though it can be caused by other conditions such as thyroid issues, gastrointestinal disorders, or diabetes, it is essential to rule out more serious causes like cancer. Early detection is key in managing many forms of cancer, and unexplained weight loss could be one of the first signs that your body is trying to tell you something is wrong. If you notice this change, it's important to consult a healthcare provider to investigate further. Signs 2. Fatigue. Persistent fatigue is a significant health concern, particularly when it doesn't improve with rest or a good night's sleep. This type of fatigue is not merely a result of physical exertion or a busy lifestyle. It can indicate more serious underlying health issues, including cancer. One of the primary causes of this relentless fatigue is anemia, a condition characterized by a deficiency of red blood cells or hemoglobin in the blood. Anemia can arise from various factors, such as nutritional deficiencies like iron, vitamin B12, or folate, chronic diseases, or bone marrow disorders, all of which can be associated with certain types of cancer. When the body lacks sufficient red blood cells to transport oxygen effectively, it can lead to a profound sense of tiredness, weakness, and a general feeling of being unwell. Moreover, fatigue related to cancer may be accompanied by other symptoms, such as unexplained weight loss, night sweats, or changes in appetite, which can further highlight the need for medical evaluation. Patients often describe this fatigue as an overwhelming exhaustion that is not relieved by sleep, making everyday tasks feel daunting and challenging. In addition to anemia, persistent fatigue can be linked to other health issues, such as hormonal imbalances, chronic infections, or autoimmune disorders. These conditions can drain the body's energy levels, leading to a constant sense of fatigue. It is essential to consider the context of other symptoms, such as persistent pain, changes in bowel habits, or unusual bruising, which may provide additional clues to the underlying cause. If you or someone you know is experiencing unexplained and persistent fatigue, it is crucial to consult a healthcare professional. They can conduct a thorough evaluation, including blood tests and imaging studies, to determine the root cause and recommend appropriate treatment. Early detection of underlying health issues can be vital for improving overall health outcomes and ensuring effective management. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Signs 3. Persistent pain. Persistent pain is one of the significant warning signs that may indicate an underlying health issue, including cancer. If you find yourself experiencing pain that doesn't subside or, more alarmingly, worsens over time, it's essential to pay attention to this symptom and consult a healthcare professional. The nature of persistent pain can vary widely. It may present as a dull ache, a sharp stabbing sensation, or a constant throbbing. It can occur in various parts of the body, but areas such as the back, abdomen, and bones are particularly noteworthy. For example, back pain that feels different from your usual discomfort, such as pain that radiates down your legs or is accompanied by unexplained weight loss, can be a red flag. Similarly, abdominal pain that seems to linger without a clear cause could be related to conditions such as pancreatic or ovarian cancer, especially if accompanied by changes in appetite or digestion. Bone pain can also be particularly concerning. It may manifest as persistent discomfort in specific bones or joints, which may be mistaken for arthritis or general aging. However, when this pain becomes more severe or begins to interfere with daily activities, it warrants further investigation. Moreover, persistent pain is often accompanied by other symptoms, such as fatigue, changes in bowel or bladder habits, or unexplained lumps and swelling. These accompanying symptoms can provide crucial context for healthcare providers in diagnosing the underlying cause of the pain. It is essential to note that while persistent pain can indicate cancer, it is not exclusive to malignancies. Various conditions, including infections, autoimmune disorders, and other non-cancerous health issues, can also cause chronic pain. Therefore, if you notice pain that is unusual for you and does not improve with standard treatments, seeking medical advice is vital. Early detection and intervention can significantly impact the outcome, so do not hesitate to discuss your symptoms with a healthcare professional. Signs 4. Changes in bowel habits. Changes in bowel habits can serve as a significant indicator of underlying health issues, particularly concerning the colon or rectal regions. It's essential to be attentive to any persistent alterations in your bowel movements, as they may signal potential problems that warrant further investigation. One of the more common changes people may experience is persistent constipation. While occasional constipation is relatively normal, characterized by infrequent or difficult bowel movements, a sustained pattern that lasts for weeks or even months should not be ignored. This can manifest as a sensation of incomplete evacuation after a bowel movement, straining during the process, or a reduced frequency of bowel movements. If you find yourself struggling to have regular bowel movements, or if the stool appears unusually hard or lumpy, it may be time to consult with a healthcare professional. Conversely, diarrhea is another symptom that can indicate underlying health concerns. If you experience a significant increase in the frequency of your bowel movements, or notice that your stools have become loose or watery, this can point to various issues, including infections, inflammatory bowel diseases, or even certain types of cancer. Particularly concerning is diarrhea that persists for an extended period, typically defined as lasting more than a couple of weeks, as it may lead to dehydration and other complications. Additionally, one of the most alarming signs to be aware of is the presence of blood in your stool. This can appear as bright red blood, indicating bleeding in the lower gastrointestinal tract, or as dark, tarry stools, which may suggest bleeding higher up in the digestive system. The appearance of blood should always prompt immediate medical evaluation, as it can be a critical sign of colorectal cancer or other serious conditions. In summary, monitoring your bowel habits is vital for maintaining your overall health. If you notice persistent changes, whether it's ongoing constipation, sudden bouts of diarrhea, or the presence of blood in your stool, it's essential to seek medical advice. Early detection and intervention can significantly enhance the effectiveness of treatment and improve outcomes for conditions related to the colon and rectum. Remember, being proactive about your health can make a meaningful difference in your well-being. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Signs 5. Changes in urinary habits. Changes in your urinary habits can serve as critical indicators of potential health issues, particularly regarding bladder or prostate cancer. If you begin to notice alterations in your urination patterns, it is essential to pay close attention to these symptoms, as they may be your body's way of signaling a problem. One common change you might experience is an increase in the frequency of urination. You may find yourself needing to visit the bathroom much more often than you typically do, which can be especially disruptive during the night, a condition known as nocturia. This frequent urge to urinate can interrupt your sleep and daily activities, leading to increased fatigue and discomfort. In addition to increased frequency, you may also encounter difficulty with urination. This might manifest as trouble initiating the stream or experiencing a weak flow that makes it hard to fully empty your bladder. You could feel a sense of urgency, yet find it challenging to start urinating, resulting in frustration and anxiety. This struggle can lead to a sensation of incomplete bladder emptying, leaving you feeling uncomfortable and compelled to try again shortly after. One of the most concerning symptoms to watch for is the presence of blood in your urine, medically known as hematuria. This can range from visible blood, which may give your urine a pink or reddish tint, to microscopic traces that only a laboratory test can detect. Even small amounts of blood in the urine should not be ignored, as they can indicate underlying conditions that require immediate medical evaluation. Changes in urinary habits can be attributed to various factors, including infections, benign prostate enlargement, or more serious conditions such as tumors in the bladder or prostate. It is crucial to understand that while these symptoms may arise from less serious issues, they can also point to more significant health concerns that require prompt attention. If you notice any of these changes, whether it's an increase in frequency, difficulty urinating, or the presence of blood in your urine, it is vital to consult a healthcare professional without delay. Early detection and diagnosis are key to effectively addressing potential issues, and your doctor can perform the necessary tests to determine the cause of your symptoms. Remember, taking action at the first sign of change can significantly impact your overall health and treatment outcomes, so it is essential to remain vigilant and proactive about any changes in your urinary patterns. Sign 6. Lumps or bumps. The appearance of any new lump or bump on your body serves as an important health indicator that should not be overlooked. It's essential to seek prompt evaluation by a qualified healthcare professional if you notice such changes. This recommendation is applicable to any area of the body where lumps or bumps may arise, including the breast, neck, groin, armpits, abdomen, and other regions. Lumps and bumps can vary significantly in terms of their size, shape, and consistency, and each characteristic may provide clues regarding their nature. For instance, a lump that is firm and immovable may prompt different considerations than one that is soft and mobile. Furthermore, the presence of any additional symptoms, such as pain, tenderness, swelling, changes in color or texture of the overlying skin, or the onset of any systemic symptoms like fever or unexplained weight loss, can offer critical information for your healthcare provider. It is also important to remember that lumps can arise from a range of underlying causes. While many lumps are benign, such as lipomas, fatty tumors, or cysts, others may be indicative of more serious health issues, including infections, inflammation, or even malignancies. For example, breast lumps may be associated with benign conditions like fibrocystic changes or can raise concerns for breast cancer. Similarly, a lump in the neck could be a simple swollen lymph node due to an infection, or it might warrant further investigation for more serious conditions. If you discover a lump or bump, take the time to assess it. Consider factors such as when you first noticed it, whether it has changed in size or appearance, and any associated symptoms you may be experiencing. Documenting these details can be incredibly helpful during your medical evaluation. It's essential to prioritize your health and well-being by not dismissing these signs. Early detection and intervention can significantly improve outcomes for many conditions. If you notice any unusual growths or changes in your body, do not hesitate to reach out to your healthcare provider for a thorough examination and appropriate diagnostic tests. Taking these proactive steps not only contributes to your overall health, but also provides peace of mind, knowing you are attentive to your body's signals. Remember, your health is your most valuable asset, and addressing any concerns early on can make a significant difference. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Sign 7. Persistent cough. One of the most concerning signs associated with lung cancer is a persistent cough that lingers despite treatment efforts. Unlike a typical cough that may arise from a cold or respiratory infection, a cough linked to lung cancer often has distinct characteristics and may not improve with over-the-counter remedies or prescribed medications. This persistent cough can manifest in various ways. It might start as a mild irritation in the throat and gradually intensify, becoming more frequent and severe. Patients often describe it as a dry, hacking cough, but it can also be productive, producing sputum that may be tinged with blood. The cough can be particularly troublesome during physical activity or when lying down, leading to sleep disturbances and increased fatigue. In addition to the cough itself, individuals may experience other concerning symptoms. Shortness of breath is a common companion to this cough, making even simple tasks like climbing stairs or walking short distances feel exhausting. This breathlessness occurs as the cancerous cells interfere with normal lung function, causing blockages or fluid buildup in the lungs. Hoarseness is another symptom that may accompany a persistent cough in lung cancer patients. This change in voice occurs when the cancer affects the nerves that control the vocal cords, leading to changes in pitch and volume. The hoarseness may be persistent and not improve with rest or hydration, further indicating the need for medical evaluation. Recognizing these symptoms and seeking medical advice promptly is crucial. Early detection of lung cancer can significantly impact treatment outcomes and improve the quality of life. If you or someone you know is experiencing a persistent cough along with shortness of breath or hoarseness, it is essential to consult a healthcare professional for a thorough evaluation and appropriate diagnostic testing. Signs 8. Changes in skin. Unusual skin changes can often serve as critical indicators of underlying health issues, particularly skin cancer. One of the most concerning signs to watch for is the appearance or alteration of moles. If you notice any moles on your body changing in size, shape, or color, it's essential to pay attention. For instance, a mole that was once small and round might become irregularly shaped or significantly larger. Changes in color, such as darkening, uneven pigmentation, or the emergence of multiple shades within a single mole, can also be red flags. In addition to moles, new sores or lesions on the skin that do not heal can be a significant cause for concern. While many skin wounds can heal within a few days to weeks, persistent sores that linger or worsen may indicate a more serious condition. Look for sores that bleed easily, crust over, or are accompanied by itching or pain. These symptoms can be signs of basal cell carcinoma, squamous cell carcinoma, or melanoma, the 3 main types of skin cancer. Furthermore, consider any changes in the texture of your skin. Areas that become scaly, rough, or unusually firm could indicate precancerous conditions or cancer itself. Other alarming signs may include the development of red, inflamed patches or dark lesions that stand out from the surrounding skin. Regular self-examination of your skin is crucial for early detection. Be proactive in monitoring your skin, paying close attention to existing moles and any new growths. If you notice any of these changes, it's imperative to consult a healthcare professional for further evaluation. Early diagnosis and treatment can significantly improve outcomes for skin cancer, making awareness and vigilance key components in maintaining skin health. Remember, when it comes to changes in your skin, it's always better to err on the side of caution. If you are still watching this video and finding these lessons useful, please comment number 4 below to let me know that you are still watching this video with me. Thank you for your valuable time. Signs 9. Night sweats. Night sweats. Experiencing night sweats can be more than just an uncomfortable annoyance, especially when they occur without any apparent reason, such as hot weather or heavy bedding. Night sweats are characterized by excessive sweating during the night that may soak through clothing and bedding, often disrupting sleep. While various factors can contribute to night sweats, including hormonal changes, infections, and certain medications, persistent or unexplained night sweats can be a significant symptom of underlying health conditions, including certain types of cancer. In particular, night sweats can be associated with cancers such as lymphoma and leukemia. Lymphoma, which affects the lymphatic system, often presents with other symptoms such as swollen lymph nodes, fever, and unexplained weight loss. Similarly, leukemia, a cancer of the blood and bone marrow, may also lead to systemic symptoms like fatigue, frequent infections, and easy bruising, along with night sweats. These symptoms can occur due to the body's immune response and metabolic changes associated with cancer. It's important to recognize that while night sweats can be a concerning symptom, they are not exclusive to cancer and can arise from various benign causes. For instance, menopause, anxiety disorders, or infections like tuberculosis may also lead to night sweats. Individual experiences with night sweats can vary significantly, and their presence alone does not confirm a cancer diagnosis. Given the potential implications of night sweats as a symptom, it is essential to take them seriously, especially if they occur alongside other unexplained symptoms or changes in health. If you find yourself experiencing frequent night sweats, it is crucial to consult a healthcare provider for a thorough evaluation. A healthcare professional can conduct a comprehensive assessment, including a review of your medical history, a physical examination, and any necessary diagnostic tests to determine the underlying cause of your symptoms. Early detection is key in the fight against cancer, as it can significantly improve treatment outcomes and survival rates. Therefore, do not hesitate to seek medical advice if you notice any concerning symptoms. Being proactive about your health can lead to timely interventions and better overall health management. So, what have you learned today about the often ignored signs of cancer? We've covered a range of symptoms from unexplained weight loss and fatigue to changes in bowel habits and skin abnormalities. Remember, these are just general signs and individual experiences may vary. It's crucial to pay attention to your body and seek medical advice if you notice any of these symptoms. Early detection is key in the fight against cancer, as it often increases the chances of successful treatment. In the comments below, share one thing you've learned that you'll put into practice in your daily life. It could be scheduling regular checkups, paying attention to changes in your body, or simply being more aware of the signs of cancer. Remember, taking proactive steps toward your health can make a significant difference. If you found this video helpful, please leave a comment below, and don't forget to like, share, and subscribe to our YouTube channel for more health and wellness tips. Together, we can raise awareness about cancer and empower others to take control of their health.